Hi, this is Dr. Kolodenker. I wanted to talk to you today about kids that have flat feet, parents that bring in their kids for evaluation thinking that their feet are too flat, there's no arch. The pediatrician saw the feet and thinks that there might be something wrong with it. Parents talk to their friends and they have orthotics, or they have some kind of an insert, or they have to do something. So there's a lot of misconception out there on what needs to be done for flat feet, especially this is specifically for non-painful flat feet. So kids don't usually develop an arch until ages 5, 8 even sometimes. Their feet are a little chunky, they have a good amount of fat on them, so it's really difficult to evaluate the arch. But the important things to look for are going to be symptoms of pain. So they'll ask you to rub their feet a lot, they'll grab their feet during walks, they'll want to stop and they'll hold their feet, they'll complain that their feet hurt, they'll be constantly kicking off their shoes. So all those are symptoms of painful type of flat foot, but this is more specifically for the kid who has just a flat foot but no symptoms involved at all. So it used to be thought that putting them in an orthotic would help to create an arch, which really is not true. Orthotics at that age group, and all age groups really, act something like glasses would. When you're wearing them, they work. When you take them off, your vision goes back to the way it always was, and same thing with the foot, it'll go back to the same that it always was. So don't think that because you have a flat foot, wearing an orthotic is going to increase the chance of developing an arch in the future. It really would just be a waste of money. If the feet become painful, then an orthotic is a good option to help support the arch, support the tendons, take some load off the tendons, and relieve the pain. But if there's no pain involved at all, just good supportive shoes is all that's needed. A good stability shoe to prevent overpronation is a good idea. I have plenty of patients that are adults that have flat feet and no pain at all. So really not a big deal. It's important to evaluate the hips, evaluating how much they roll in and out, the position of the knees, and that will give you a much better generalized idea on exactly what the cause of the flat foot is. Is it because they're really rotated in from the hips? Is it because it's coming from the foot? So when it comes time to treatment, it's really, really important. So the most important thing to do is really assure parents that just because there's no arch seen, nothing to worry about. As long as there's no pain involved, really just monitoring is all that is required.